Good afternoon, everybody, and I'm joined today by Gemma Stainthorpe from Public Health. Good afternoon, Gemma. How are you?
Good, thank you. And you?
Very well indeed. Welcome everybody to this week's update on our risk indicators for events and festivals. Thank you very much for the people who have contacted us and give us some feedback, and I'll try and build some of that feedback into our presentation for this week. As you know, and as you can see from this slide, we have a number of health-based indicators that we're looking at in terms of events and festivals that people are planning over the late spring and summer period. And Gem and I are going to give you an update on where we are on each of these, and then I'll cover some of those points that people have raised previously. So Gemma, shall I hand over to you, and then you can share some of the rates and where we are at the moment?
Sure, thanks, Jonathan. So I'll just share my screen and just take you through some of the recent rates of COVID across Warwickshire. So here we've got a graph showing the rolling rates per 100,000 population, averaging over the last 7-day period at each point, and we have the different colours here representing the different district and boroughs. So as I move along here, coming through to March and now into April, we saw historically over a few weeks ago, we saw a peak associated with potentially schools and young people, particularly in Rugby and North Warwickshire area. These then started to come down and be in line with the rest of the county. And now we're sitting, if I just come right to the end here, we're sitting at Warwickshire as on average is coming in at around 31 per 100,000 population averaging. So that's sitting nicely under our indicator of 50 per 100,000 population. So that's obviously looking really good. Just to be mindful, I could see a very, very small, and it's across the board, but a very, very, very small increase here over probably the last few days, perhaps the last week. Just something to keep an eye on. It is across the board. Just looking at this and obviously being mindful of where we are in the roadmap, thinking about things starting to reopen. It's Easter holidays as well. People may well be seeing each other outdoors. So just to keep an eye on that. But we've got here, North Warwickshire is 46 per 100,000, and we've got Rugby coming in at 51.4, so that's the highest for the county. And then at the lowest we've got Warwick coming in at 18.8, and a slight rise from Stratford there at 26. So just to give you an indication of where we're going, I think it's safe to say that we may well see a little bit of an increase over the next few weeks, especially given the fact that we have opening of retail, close contact services, and obviously outdoor hospitality. But we just need to keep an eye on that and how that affects things and other indicators moving forward. So we do just need to keep a general eye on things. I will also show you another graph here. So this is cases in the age 60 plus. So these are our test result cases here. So we're coming obviously March and then well into April now. Again, luckily and fantastically, they've come down really, really well, and we're still in very, very low single figures there, and not seeing any significant rise within that age group, which is great, due to the fact they are obviously high risk. So if I just stop sharing my screen on those ones. So that just to give that overview, I've got some vaccination uptake data as well here with me. So from last week, there's been small increases for every age category that we have the data for. So looking at the 80 plus age category, they're now at 96.8, and last week they were at 96.4. So it's in those age categories, the increase now is going to become smaller as more people are covered. So so small change there. We've got the 70 to 79. Again, that's just been a 0.2% of a change there. They're at 95.8%. Then we've got the 60 to 69s, at now 92%. Again, small increase there. And then we've got the 50 to 59s now at 87.3%, and it was 86.8% last week. So a little bit more of an increase within that group. And we're hoping, obviously, with the 50 to 59s, we'd like to see a far higher uptake now over the coming weeks. So I think some tailored communications will hopefully be going out for that group, and hopefully we'll get to see some other age group data soon. So that'd be good.
That's really helpful, Gemma. And I think we've also seen quite a big increase, aren't we, on second dose vaccinations as well. So it might be worth in future weeks just so we can give people an update on where we are on that, because that's another really good indicator for reassurance within those higher risk categories. In terms of the impact on hospital rates at the moment, we have very high capacity within hospitals. We're not seeing those very small rises translate into hospital admissions, and we'll obviously keep an eye on that. Quite often there's a lag if there were to be an increase in hospital admissions, but that's not coming through yet. And as Gemma says, those small rises are things we'd be anticipating with more retail sectors opening up, increases in things, social activity taking place. So that's something we'll just keep an eye on and make sure through this weekly blog we keep everybody updated. The other thing just to mention is variants. We've mentioned before variants in terms of the Kent variant and the South African variant. The one thing we are keeping an eye on is some of the increases in terms of the South African variant, which is having a bit of an impact to the south of London, South London area. We are just keeping an eye and make sure again that doesn't have a much wider spread and affect our region in the same way as the Kent variant did before. So we'll keep a close eye on that on across coming weeks. So just in summary, if you were to be holding an event next week in the county, we would be pretty positive that those events could take place, and we would be encouraging people to go ahead with their plans if they were taking place next week based on that. We're keeping an eye on the very mild, very slight increases, and if that South African variant we're seeing in one part of the country does start to spread any further, that's the update. A couple of questions that have come through this week. Someone mentioned to us or asked if we could just clarify about the combination of risk indicators. We have actually a total of 9 risk indicators. The health ones we've got on here, and then a couple of other indicators in relation to event organisers, their COVID plans and their own risk assessments, and the ability of management to respond to changing pictures. So you are quite right, we are looking at that combination. If there was something really significant that we were seeing, for example, that rise that Gemma talked about, we actually saw that steadily increasing over a period of time, then we would want to be having a fairly urgent conversation with event organisers just in order to respond to that. So, but that would impact on a couple of the indicators anyway. So we are looking across that whole basket, not just the individual changes. Somebody also asked us a question about if rates were low, really low in one part of the county, and their event was only for people within that area of the county, whether actually the other rises or the other indicators would have a bearing in other districts and boroughs. That very much depends on your event, the event you're running, but we would very much be happy to have a conversation with you just to talk through your COVID risk assessment and the plans, just to make sure that there wasn't anything we would suggest that you put into place or any pre-checks or balances. But as you can see, all the districts and boroughs are in a pretty positive shape right now, which is really good. I don't know if Gemma, is there anything else you want to add?
No, that's all from me. Thank you.
Good. Thank you everybody for tuning in, and we look forward to giving you the next update next week. Take care, everyone.
Thank you.